Welcome primary school parents from Kinder to Year 6. My name is Miss Jordan Farrugia and today I have the pleasure to talk to you about health, sport and physical activity in Australia. Please enjoy and feel free to ask any questions at the end of the presentation. Thank you. Major health issues that impact the Australian youth. The National Health Priority Areas, NHPAs, are conditions that the Australian Government continues to focus their attention on, as they have a significant contribution to the burden of illness and injury across Australia. These 9 NHPAs are cancer control, cardiovascular health, injury prevention and control, mental health, diabetes, asthma, arthritis, obesity, and dementia. However, not all these NHPAs are a big problem for our young people. Ruskin defines the major causes of death for young people to be accidents, poisonings, violence, suicide, and cancer. This highlights 3 of the 9 NHPAs as a problem for young people, those being injury prevention and control, mental health, and cancer control. I would also like to highlight obesity, as the 2011 and 2012 Bureau of Statistics recorded that 25% of children are obese. That means theoretically a quarter of the children that go to our school are obese. So, what can we do about it? That's a question to be discussed later. Patterns and causes. The good news for Australia's young people is that most do enjoy good health. In fact, according to Ruskin, young mortality rates have halved between 1987 and 2007. This is largely due to the declines in injury and poisoning rates. I believe this is likely due to more risk precautions such as safer cars, roads and seatbelts, and overall parenting. Young people between 12 and 24 years, which are soon to be your children, are among the healthiest people in the whole population. However, as we would expect young people of Australia to be among the healthiest, we would also expect that young people are more likely to die from a preventable cause of death. Young people experience lower levels of mortality compared with other population groups. This is good news. However, they experience a higher level of morbidity in preventable illnesses and diseases such as mental disorders, injury and poisoning. Other areas of concern are that Indigenous young people have poorer outcomes in many areas, with their death rates being twice as high. Death rates from road transport are still high, particularly for young males, and intentional self-harm among young females is significant. Effects. The 4 determinants of health, environmental, socio-economic, socio-cultural, and individual factors, act as a constant seesaw that can create an unbalanced negative effect on the health of young people. For example, the socio-cultural determinant of health encompasses family, religion, culture, peers, and the media. It is easy to understand how a stressful family life, including a messy divorce and relocation, can impact upon a young person's mental health. How physical activity and sport have the potential to help the youth of Australia. Regular physical activity during childhood and adolescence is associated with improvements in physiological and psychological health. Nevertheless, only 27% of girls and 40% of all boys reported to have the suggested levels of activity by the World Health Organization. That's 1 hour of moderate exercise every day. A 2005 study found the following benefits for regular physical activity. Positive effects on musculoskeletal health and cardiovascular health, reduced buildup of fat cells in the body, improved blood pressure, and overall mental health. The study also reported low levels of injury in PE classes and supervised after-school programs. I would like to note here that however extensive the physical, emotional, and mental benefits are, there are also spiritual and social benefits as well. For example, feeling a sense of belonging and being a part of a greater whole through meeting new friends. So, if we are to break down our three most preventable NHPAs, injury prevention and control, mental health issues, and obesity, we can find some statistics that point out, yes, 25% of Australian children are obese, but 63% of adults are, highlighting the decline in physical activity during adolescence to be a special concern. Also, 26% of young adults aged 16 to 24 had mental health issues according to the 2007 National Survey of Mental Health. But the most shocking data is that for young adults aged between 15 and 24, 53.8% of female deaths and a whopping 72.1% of male deaths are due to injury and poisoning. Thus, whilst all health issues are important to address, I believe it is a priority for injury and poisoning to be tackled through the implementation of more physical activity and sport and education in our children's lives. Achieving better health outcomes. It will take a whole effort from schools, families, and the surrounding community to achieve better health for the whole population, in particular the youth of Australia. Many Australian youth health initiatives, such as Smarter Schools and Partners for Learning, prime themselves on fostering these connections, as many know that when properly done, enhanced connections among schools, families, and communities should lead to a marked reduction in young people's problems. Tackling obesity. A study carried out in 2006 found that providing game equipment was effective in increasing children's activity levels during recess and lunch breaks. Another study of a sports, play and active recreation for kids program found that a more active curriculum can benefit 97% of elementary school students in their strength and endurance. However, doctors from the Department of Pediatrics in Vancouver did a study on the effects of physical activity programs in schools and found no correlation between the implementation of these activities and reduced BMI in obese children, meaning obese children will need extra support from home. Simple strategies to help are limiting screen time, including television and video games, encouraging out-of-school sport, and healthy eating. Tackling mental health. The strongest evidence suggests that physical activity and exercise can alleviate some symptoms associated with mild to moderate depression, provide a beneficial adjunct for alcoholism and substance abuse programs, improve self-image and social skills, reduce the symptoms of anxiety and physiological responses to stress. However, the effects of physical activity on mental disorders such as schizophrenia are not known, and negative psychological effects from exercise have also been reported. However, the small correlation between physical activity and ongoing wholesome mental health, primary studies show consistent negative associations between mental health and sedentary behaviour. Thus, physical activity initiatives in schools and the community should be paired with self-esteem boosting feedback and encouragement and followed up with education and support on the symptoms and alleviators of mental health. However, caution must be taken as if poorly done, further isolation from students could be apparent. Tackling injury and poisonings. With alleviations of mental health, we can hope for a reduction in intentional injuries and poisonings across students. But for unintentional injuries, a cross-study found that sports and recreations were the most common activities associated with injury. However, this includes all injuries from minor to severe. A study carried out in Victoria from 2001 to 2003 recorded 1.8 and 0.6 severe injuries and deaths respectively per 100,000 participants. That's not even 0.00001% of deaths per participant. Thus, the likelihood to die from playing sport is very, very low, and the health benefits from physical activity override it. A study conducted in 2000 found that community-based approaches are effective at increasing some safety practices, such as bicycle helmet use and car seat use among children. However, evidence of other several categories of childhood injuries was less compelling. Nonetheless, I believe it is a school's responsibility to provide community safety and drug education lessons in the classroom, similar to the curriculum implemented at Albury Public School. It is a further parent's obligation to implement household boundaries to reduce the dangers of risk-taking of his or her child. All the initiatives justified today are being looked at to be implemented here at our school. Other initiatives we are also looking at are yoga and more active movement incorporated into lessons, a health promotion student council, more bike racks, and rewards for those who ride to school. If you have any further ideas and would like to get on board, please contact me. Thank you for listening.